Gracias, Jordi. Next up, Oriol Fuertes, CEO and co-founder of Qida. The home care platform raised 37 million euros just a few months ago. So the stage is yours. Oriol, welcome.
All right, well, thank you so much, everyone. It's a pleasure to be here. Thank you for the organizers for the event. I would love to share a bit who we are, what we do, what sets us apart. My name is Oriol Fuertes, CEO and founder of Qida. And basically, what we strive to do, so we are a social impact scale-up, and we exist to support the health and social care system sustainability. So the moment that the health and social care system, if one day is sustainable, we should not exist anymore. That's what moves us. So we don't want to create the biggest in the world home care organization. Honestly, that doesn't motivate me. What really motivates me is to support the health and social care system sustainability. And we believe that to do so, we have to maximize two outcomes. Outcome number one is the quality of life of people at home. After so many years working with governments, what I learned was that it is impossible for governments to do what is necessary to do to make a health and social care system sustainable. It's really hard, not only because of their constraints, but also because the citizens, we are not mature enough to accept some of the changes that it takes. And after all those years, I said, well, the only thing that is going to support people to make a health and social care system sustainable is if we help people use it less. And so by keeping people at home for longer, we can support them using the health and care system less. So that's outcome number one. Outcome number two is to support the ability of the health and social care system to work more effectively and efficiently amongst themselves. Today, not only here in Spain, but in many countries that I've been around, they really don't work together. We can write in many articles, but the ability of health and social care to work together is minimum. Why is that? Different data sets, but more importantly, different cultures. And so through technology and through agents of change, we have to help them work together in a collaborative manner. So those are the two outcomes we need to maximize to support the health and social care system sustainability. Up until today, we've supported over roughly 30,000 people, and I'll give you some more data about the company. When we look at how to achieve this mission, we think that there are 5 different angles that we need to take to achieve this systemic change. And so let me pause here. What is a systemic change? A company that aims to achieve a systemic change is a company that aims to create a business model by changing a system that doesn't work. I don't want to make money out of a system that doesn't work. If the system is broken and I'm making money out of that, I'm failing as a human. What I want is to fix the healthcare system by creating a sustainable business model. And so to achieve that, I think, or we believe that there are 5 angles we need to take, and these are the 5 different business units that we have at Qida Group. The first one is prevention. Today, over 40% of diseases, neurocognitive diseases, are preventable by changing our habits as humans. What we eat, what we drink, how much sport we do, who we talk to, etc. So we engaged with CaixaBank and VidaCaixa, the largest bank and the largest insurer in Spain, to create the first insurance product in the world that insures Alzheimer, Parkinson, multiple sclerosis, ALS. What we did with them is what we created is a product that you buy, an insurance product that you buy between the age of 60 and 75. And for every euro you invest, there are 3 outcomes. Outcome 1 is if before the age of 90 you get the disease, you get 3 times the money that you invested. Outcome 2 is if you go over the age of 90 without the disease, you get 70% of the money back. Outcome 3, if you die before the age of 90 without Alzheimer or one of these diseases, you don't get anything, but you don't need it, unfortunately. So what we're doing is we're mutualizing the risk. The risk of people getting Alzheimer is paid by those that won't get it. And so this is angle number 1 of prevention. But angle number 2 is through the tech platform, we support people when they can still prevent the disease by changing their habits. And so at the end of it, through prevention, the first BU, we're solving 2 key problems that the health system has. One is access. Public systems cannot pay for the amount of money needed to care for people at home. Today, we just take, we take Spain, we invest 2 billion in home care, public funding. We cover like 15, 20% of the need. So what happens? Those that have money will top up with private. Those that don't have money have an access problem. By saving and by mutualizing the risk, we can support solving that problem. The second big problem that we have is that people don't take care of themselves. So we need to support them in changing their habits when there is still time. So that is the prevention one. Focus in Spain is the first one that we will take international because we believe there is a huge opportunity here. In less than 4 months, over 2,500, so 2,500 people have got injured from Alzheimer, Parkinson, and dementia in the last 4 months. Number 2 and number 3 is private and public home care. Right? So here we advance in the life of people. The last 3 to 4 years of life is when we spend over 55% of the public resources. For a private company like ours, we believe it is not consistent if we don't collaborate with the public. This is all a speech of changing the system. I need to work with the public because the public is the one that has the money, has the funds, and is the one that is taking care of the elderly majority because private insurers at 95 are excluding, of course, these patients. So we have to work with the public institution. And so here we provide human care and technology to take care of people at home. But we are here to transform what exists, and transforming through 2 main angles. One is technology, which I will tell you about, and the second one is the social status of the caregivers, how we train them, how we support them, and how we speak to them and treat them. The fourth one is SaaS, software as a service. Okay, we can have an insurance product that helps people save, that change their habits. We can have great caregivers that treat people at home, but the health system is blind to what happens at home. We keep writing and writing, and I've personally written it, more than 30 strategic plans for Catalonia, rest of Spain, UK, Switzerland, US, all of them say the same. The healthcare system needs to be preventative, proactive, needs to empower the professionals, and of course needs to assess everything. The reality is that it's not happening. Part of the problem why it's not happening is because we are blind to what happens at home. We keep saying we need to be proactive, but we don't know how is the patient at home until that person shows up in A&E. So it's not about asking the health professional to visit more the patient at home. That's not sustainable. At most, you can visit it once a month. Okay, 12 times. So your chances of getting an exacerbation is 12 over 365, nothing. So instead, what we need to do is to monitor the patient at home and generate those alerts to the healthcare system. Okay, easy to do when you work with private. Now, get that done with public. How a private institution integrates everything that is happening at home with the health data. So what we've done here is we won a big tender with CatSalut here in Catalonia to develop a platform that is called the Admit platform that monitors the patients at home and connects that data with the health, primary care, and the social care. So that's the first thing, helping them not be blind and get an exacerbation before it's happening. The second thing that we have in the SaaS is allowing them to work together, do a health assessment joint together, and a care integration plan together, right? Because as of today, if you take Spain, over 13 professionals enter an elderly patient at home every year. You have the primary care, the social care, the home care professional, the physiotherapist, the teleassistants, everyone is there with a different plan. We have 13 different plans of intervention. There should be just one, the one of the person. So this platform helps you create that. When we are taking that from Catalonia to the rest of Spain and then internationally. We believe that platform helps and supports that. And the last one that people need is the one-stop shop. You need a place when you can access, as a family, everything you need to take care of your father or your mother. Because at the end, if this vision comes through, when it comes through, you will have the money to pay, you have the support to prevent, you have the right caregivers in collaboration with the public institutions, you will have the technology, but then you will still need to refurbish your home. You will still need funding to pay it. You will need a marketplace to access all of that. So that's a bit the vision that we have built up until today. A bit the phases, right? So we are building the leader in Europe of quality of life for the senior. And I always like to explain that we are doing that in 5 phases, 5 stages. We started before COVID. We are now starting our year 8, and we are now in phase number 4. So phase 1 was, okay, do private home care in one market, Catalonia. That was before COVID. We were selling 1 million a year We raised a small round. We were a team of 30 people. Fine. We proved that it was possible to do it. The second one is take private home care and take it nationally. We went to Madrid, we went to Basque Country, we went to Seville, we went to Galicia. We expanded the company. We were selling around 3 million a year. Then came business diversification. Is when the vision, we were investing for many years, is when the vision happened. We launched the insurance product. We started doing, we have over 100 contracts with public institutions across Spain. We launched the SaaS, and we reached 27 million in sales. And today we are around 40 million, so we've done times 40 in the last 3 years. And our goal is to become national leaders in Spain. That is our current goal. Once we've achieved that, we'll take the company international. Every phase, we only go to the next one when we complete the phase. So if it takes me 1 more year, it takes me 1 more year, it's fine. I don't want to take more complexity to the business. The goal is to do step by step what is the right thing to do. So everything boils down to talent. Talent wins. The competitive advantage of the company needs to be talent and culture. The rest is music. The rest can be copied. But at the end of the day, my obsession is how do I create a culture that combines 2 fundamental aspects. We care, so we care for people. We need to be ethical. We need to be fair. We need to be best standards with go big or go home. So how do I combine care with ambition? How do I combine care with the speed? And that is hard. Right? I have social workers, physiotherapists, speech therapists. I have a lot of health professionals in the organization. At the same time, I have technologists, management teams. So how do I combine these 2 cultures, right? And this is the way that we have approached. I don't go through all of them, but we are a team of around 300 people in the office and over 2,000 caregivers employed directly by us, right? And we are generating 1 employment every 15 minutes. Right? So by the end of this session, we will have created another employment, and another employment, and another employment. Right? Just to end here, funding sometimes, and I know later there is a panel about this. So we raised until now around 50 million, 50, combining social impact funds as well as traditional funds. And this is fundamental in the way we think about this. I want money from social impact funds and traditional funds, because I don't want to choose between social impact and economic return. I don't want to choose. My choice is not to choose. I want very big economic returns by transforming the healthcare system, and I want to transform the healthcare system and have social impact. And so that is the combination. That's what I wanted to explain to you today. Thank you so much.